And, after they try the third time, that's it, they don't try again. It's like, oh, thank you, I don't wanna pay the shipping to send it back.
Oh, it must not be ready. We don't have the policy recommendation. Let's do it.
Recommendation.
Oh, yeah, there is. Oh, where's Miss Long? See? Thank goodness for Mary Washington.
Yes.
I mean,
I'm packing up, we're getting
I
ready.
know, I am too. Jim.
I told you, we still have something to go, we still have
Yeah.
policy. It's a
Thank you, Ms.
quick.
Weaver. Yes.
There you go again. Back up.
Right, in the spirit of School Nurse Day, we thought we'd present our new policy recommendation on naloxone. This is the first reading of the naloxone policy. This recommendation comes as a result of House Bill 1082, the Start Talking Maryland Act, which requires each county board to establish a policy including three things: authorizing administration of naloxone or other overdose reversing medication, implement a method for notifying parents or legal guardians of students of the school's policy, and obtain and store naloxone or other opioid overdose reversal medication. So you'll see as we go through our new policy recommendation, those three pieces will be captured with letters A, B, and C in the policy statement. We are recommending policy JHCJ, administration of overdose reversing medications. The purpose to ensure the provision of the emergency medical care required under the Heroin and Opioid Education and Community Action Act of 2017, which is the Start Talking Maryland Act. The policy statement, the Maryland General Assembly enacted House Bill 1082 entitled the Heroin and Opioid Education and Community Action Act of 2017, Start Talking Maryland Act, during the 2017 legislative session. The act requires that local boards of education develop the instant written policy in accordance with school health guidelines and state laws and regulations that, and these are the three pieces that we saw earlier, A, authorizes the school nurse, school health services personnel, and other school personnel to administer overdose reversing medications such as naloxone to a student or other person located on school property who is reasonably believed to be experiencing an opioid overdose. B, directs that all public schools to obtain and store overdose reversing medications such as naloxone to be used in an emergency situation. C, ensures that parents, legal guardians of all students will be notified of the availability of overdose reversing medications such as naloxone at the beginning of each school year through the annual publication of the St. Mary's County Public Schools Handbook. Definitions for the policy are overdose, injury to the body, poisoning that happens when a drug is taken in excess amounts. Naloxone, a prescription drug that can reverse the effects of opioid overdose and can be life-saving if administered in time. And opioid, natural or synthetic chemicals that interact with opioid receptors on nerve cells in the body and brain and reduce the intensity of pain signals and feelings of pain. Any questions or comments?
Mrs. Weaver.
I have questions and some comments.
Okay.
Okay, so, I understand that the nurse or a health professional would have knowledge on how to administer. Is staff going to be trained in how to do this, or is it going to be, asking staff if you would like to be trained, or how is that going to work?
So we kind of jumped right in on this policy starting at the beginning of the year. And Trish, do you want to speak to the training?
Sure. All of the school nurses were trained as trainers through the health department this past summer. And so each one of them now is training staff in the schools on a voluntary basis. In other words, quarterly I remind them to put the message out that they would be offering a training for staff, as well as when we do the CPR, first aid AED training, we offer that at the end of that training as well to staff who are already there, because that's perfect. I would really recommend that they be certified in CPR and first aid AED use, and then we offer the training as well if they would like it. So we keep an Excel spreadsheet with a list of every individual who is trained at every school. We share that with the health department as well because they're the agency that writes the order, the protocol related to administering. And so, yes, we're slowly building the number of staff who are trained to provide that medication.
Okay, the next thing is, I know that it's, can be costly for the Narcan. How many are you required to, by law, to have in each school? Is it only in the high schools? Is it high school and middle school, or all schools?
All schools.
Okay, so how many, is there usually 2 on hand in each school?
Right now, we have 2 on hand at each school. Each kit comes with 2, and so that's what we have now at each site. We have all the high schools were provided free through a pharmacy. I think it's Adapta-Pharm, and it's free for high schools. For the other sites, we've purchased a kit for each site, and then 3 months prior to their expiration, of course, then the health department, we exchange. In other words, I give them the ones that will be expiring so that they can get it out to our first responders for them to use. And then they give us ones that have a longer date of use.
Yeah, that was my next question.
Yeah,
'cause,
so that we can keep rotating, so that we keep a current supply. And they, of course, then can use that out in the community where they do tend to use it very often.
Tragically.
So.
Okay, those were my questions. Thank you very much.
My only question, that the policy indicates that you could use naloxone. Number one, there's no dosage required, so I would assume that the treating nurse would have to make that decision on her own.
Yeah, it's a unit dose, so it has the exact dose in it. You can only give that
Gotcha.
exact dose.
Okay. My question is, could there ever be an issue in which naloxone would not be the appropriate counteraction? And if that was the case, could your policy promote maybe somebody using it when they shouldn't be using it?
I think that with any emergency medication such as naloxone and similar to EpiPens, you look at and in your best judgment related to the symptoms you're seeing, that's what you choose, the emergency medication, and per the regulation and law, it does protect the individuals who provide the medication liability-wise. So I personally think it will promote the use of it. I do think that it's important that we have it to respond to anyone on school property or school grounds and make it available and make it known that it's available. I don't think that it would increase the use
Okay, or liability.
or liability.
That was kind of my concern.
Yeah.
Giving a person naloxone or Narcan, if they're not under an opioid, does not harm them.
Right.
So it is relatively benign in that aspect. So if there's a question of whether they are or they aren't, it's better to use the medication, administer it correctly, and then determine what the outcome is.
See the value of having 2 nurses on the board?
It's
I mean,
awesome.
they're just
It
bookended,
is.
they know. Subject matter
She asked, yeah, she got my question, so I'm really,
The,
I'm good.
the expiration date and the way in which we're doing that's just, that's so practical.
Yeah.
It's just really wonderful. And the sheriff's department, they're using them,
Yes,
you know, they are using them.
yes, multiple times a day, unfortunately.
Yeah.
All right, my only comment is on letter C of the policy statement. where it says about that how we're going to notify the parents and legal guardians through the annual publication of the St. Mary's County Public Schools Student Handbook. If that implies that we're gonna actually hand them a student handbook, and if we don't do that anymore, then maybe we need to rework that. Just from a
Right.
legal standpoint, it's not,
Oh, okay.
it's not really a publication if
Right.
I'm not giving it to someone, or if it's not printed anywhere.
Sure.
Okay, thank you.
Just so,
I think
When
you
we
can
go
take
that
out
route-
annual publication and just say through the
Right.
St. Mary's County Public Schools Student Handbook.
just so we don't have to go back and update it.
Okay.
But
I'll
of
look
course,
at that.
Mr. Law can
They'll
weigh
yeah.
in to determine.
look at the law for that.
Mhm.
Okay, thank you.
Mr. Washington, you got anything?
Yeah, thank you very much for bringing this forward. Thank you for being effective and efficient with our resources and turning the medication over to the health department where they turn it over to you so you'll have a longer shelf life. And I appreciate all that the nurses are doing for the students and staff. You've been with us for a long time and you're doing a wonderful, wonderful job. And happy Nurses Month or week. Thank you for all that you do.
Thank you.
Thank you.
I appreciate you. Thank
Ms.
you.
Allen, do you have anything?
No,
Okay.
thank you.
All right, now we're really done. Now, Jim,
Can
you're
I
good.
go?
Yeah, now you can go.
I got a headache.
Oh, my goodness. Well, there's like nurses everywhere.